At Southmead, we understand the importance of giving women informed choices, so we have created this short film to give you more information about having an epidural during the birth of your baby. Many women choose to use simple forms of pain relief during labour, such as taking a warm bath, pain-killing tablets, or gas and air. However, if you are still uncomfortable, you may wish to consider having an epidural. Epidurals are an effective method of pain relief, but there may be reasons why an epidural may not be appropriate for you. The My Pregnancy at MBT app can tell you about the choices available and the risks and benefits of each one. Your community midwife will also be able to answer many of the questions you might have. Epidurals are available at any time, but only on the central delivery suite. If you are labouring at home or on the midwifery-led unit and decide that you want an epidural, you will be transferred to the labour ward to facilitate this. If you choose to have an epidural, your midwife will give you an information sheet to read. Your epidural will be inserted by an anaesthetic doctor who specialises in providing complex pain relief. Although there is an anaesthetist assigned to the labour ward at all times, there could be a small delay if it's very busy. As soon as they are able, they will join you in your room. They will review your medical and pregnancy history, ask you about any medications you might be taking, confirm your allergy status, and might examine you. They will recap the risks and benefits of having an epidural and answer any questions you or your partner may have. Epidurals are very safe, but it is important to know about the small chance of problems. Sometimes epidurals are not completely effective at taking away all the pain of labour. If this happens, there are several options, including siting the epidural again. Sometimes epidurals cause your blood pressure to drop or can make you feel itchy or sick. Uncommonly, women get a bad headache after an epidural. This can go away in a few days with basic painkillers, but sometimes needs further treatment. Damage to a nerve causing a numb patch on your leg or a weak leg is rare and is usually temporary. The risk of bleeding within the back or causing an infection is very rare. Backache is a frequent concern of women requesting epidurals. Backache is very common during pregnancy and often continues after delivery of the baby, but this is very unlikely to be caused by the epidural. Some women are understandably worried about the risk of paralysis, but be assured this is extremely rare. Having an epidural can limit some women's ability to push, so there is a higher chance of needing assistance with the baby's birth with the suction cup or forceps. However, choosing an epidural does not increase your risk of a caesarean birth. It takes about 20 minutes to safely set up and insert the epidural, and it takes another 15 to 20 minutes for an epidural to take its full effect. Sometimes an additional injection in the back called a spinal anaesthetic will be offered. This usually works within 5 to 10 minutes. Before the anaesthetist places your epidural, a small plastic tube or cannula will be placed into a vein in your hand or arm so that fluids and medications can be given if required. Next, you'll need to get into position so the anaesthetic doctor can insert the epidural. This can be done with you sat up or lying on your side. In either position, you need to put your chin on your chest, try to relax your shoulders and curl over your bump. It also helps if you can push your lower back out, as this opens the spaces between the bones in your back so that it's quicker and easier to place the epidural. The anaesthetic doctor will clean your back with an antiseptic solution and then apply a sterile drape to keep the area clean. Next, they inject some local anaesthetic to numb the area. This might sting a little bit at first, but after this you should only feel a sensation of pressure, whilst a thin plastic tube called an epidural catheter is inserted through a special needle. Sometimes you might feel a strange sensation in your back or down one of your legs. Don't worry, this is normal. Just let the anaesthetist know if this does occur. It's important to stay as still as possible during the procedure. If you have a contraction, let the anaesthetist know and they'll stop what you're doing, but you'll need to stay still. As soon as the contraction wears off, inform the anaesthetist so they can continue inserting your epidural. Once the epidural is in place, it will be taped to your back and over one of your shoulders. You will then be able to roll onto your back, sit up and get yourself more comfortable. The anaesthetist will give you a small dose of the epidural medicine to confirm it's working as expected. and your blood pressure will be checked quite frequently at first. Your anaesthetist will connect your epidural to a special pump, which has a button that you can press to give yourself a dose of the epidural medicine whenever you need it. Your anaesthetist will show you how this works and get you comfortable. You should press the button once your contractions start to feel uncomfortable again. Don't worry, the pump has safety features that mean you can't overdose. Once you press the button and the medicine has been delivered, you can't receive another dose for 15 minutes. With the epidural pump, you will be in control of how much medicine you receive. Ideally, you should aim to remain comfortable, but still aware of your contractions, so that when it comes time to push, you are able to work with your body to deliver your baby. With frequent epidural doses, it's possible that your legs may become heavy and you'll not be able to move around or push as effectively as normal. Your anaesthetic doctor and midwife will make periodic checks on how well the epidural is working by using a cold spray. The epidural may take away the feeling that you need to empty your bladder, so your midwife will check to make sure you can pass urine regularly. A small tube called a catheter may need to be inserted temporarily to empty your bladder. However, with a working epidural, this isn't uncomfortable. You will still be able to move around the bed, and changing position is encouraged to ensure there is not too much pressure on any one area of the body. We discourage women from eating whilst using an epidural. However, you should continue to drink, and we recommend isotonic sports drinks to help keep your energy levels up for your baby's birth. You will be given regular tablets to help reduce the acid in your stomach. And after you have an epidural, we monitor your baby's heart rate using a sensor which is strapped onto your baby bump. Ordinarily, you will be encouraged to use the epidural right up until your baby's birth. After your baby is born, the epidural tube is simply pulled out by your anaesthetist or midwife. You will be advised to stay in bed until your legs feel strong enough to support you. An anaesthetist will visit you on the postnatal ward the next day to make sure all its effects have completely worn off. If you choose to breastfeed your baby, it's perfectly safe to do so after an epidural. Thank you for taking the time to watch this video. We hope it will help you feel better prepared if you decide to have an epidural during labour, and we look forward to welcoming you to Southmead Hospital on the day of your baby's birth.